Today we talk about limerence in psychology. My old book of psychology, Understanding Behavior. Page 10. The obsessive compulsive neurosis. Limerence is an OCD or obsessive compulsive disorder or ROCD, relationship obsessive compulsive disorder in old psychology, or also called anxiety neurosis, a feeling of secret desire within the limitations of social norms and of external reality, according to Dr. Sigmund Freud, an Australian neurologist and a psychoanalyst, year 1895. Then, past one century, the word limerence appeared through Dorothy Tenov when she wrote a book called Love and Limerence on 1979. So, limerence or OCD or ROCD and OLD or obsessive love disorder are the same. I remember my first video is about OLD. Yung hindi maintindihan pakiramdam at yung isa naman yung twin flame na pakiramdam. Yun yung pinakauna kong video. Balikan nyo yung pinakauna kong video na Tagalog. It's about hindi maintindihang pakiramdam and OLD, Obsessive Love Disorder. So, limerence is an involuntary state of intense desire. It's a state of mind which results from romantic or non-romantic feelings for another person. The person who experiences limerence is often called LE or limerence experiencer, and the person who is the object of the obsession is called LO or limerence object. The person is the object and the one who experiences limerence is the limerence experiencer. So, LA and LO. So, limerence feels excessive emotional feelings and obsession to LO. Obsessive thoughts and continually feeling trapped by an obsessive romantic attachment to an LO or limerence object. There are 3 stages of limerence. First stage is the infatuation, an addictive type behavior, starting to feel that the LO or the limerent object is a very special person, unconscious need of the limerent to feel worthy of being loved. It's fed with connection and emotional bonding and the desire to spend time with the LO. Second stage is the crystallization. It can be characterized by striking fear of loss, feeling of attachment, yung takot kang mawala siya sa buhay mo or iwan ka niya, ganon. And the third stage is the deterioration. This is the phase when limerence decays. Limerence when fade, this is the words they often said. You are not a man or woman I first met. Yan ang mga sinasabi nila. Limerence sometimes start with a simple admiration to someone, like admiring famous personalities, admiring politicians, admiring athletes like basketball players, volleyball players, and more, till it turned to obsession, feels deep attraction to that person or limerence object. Limerence today is not only a psychological state but also a neurological one caused by low level of the neurotransmitter serotonin in the brain, according to scientists and mental health. So the cause of limerence and ROCD has been associated with low levels of serotonin and elevated or high levels of dopamine. Symptoms of limerence. Number 1 is intense craving of reciprocity. Yun bang, dahil minahal kita, mahalin mo rin ako. Parang yung ganon. 2 is creating fantasies and intrusive thinking. Thinking they are perfect match. Then, emotional highs and low. Fear of rejection. Yung takot siyang ma-reject. Yan. Someone who experiences limerence is largely selfish. They focus on their own feelings and needs. Frequently jealous. Obsessed creating closeness and emotional bond to the LO or limerence object. Then, trying hard to impress the limerence object, for example, changes the way they dress, changes their hair, changing their habits, change their religion to make the other person happier with them. A person will be in the state of limerence when this powerful neurotransmitter chemical surge in a high level, including dopamine, noradrenaline, and phenylethylamine. Again, limerence is a condition of cognitive obsession caused by low serotonin levels of the brain and high levels of dopamine or brain chemical imbalance. Anybody has the possibility to have limerence disorder if this neurotransmitter chemical of our brain will surge, depreciate, or imbalance. We should treat limerence disorder because if remain untreated, it will develop into BPD or borderline personality disorder, a feeling of rage, deep sorrow, shame, terror, and severe emptiness and loneliness. This disorder produces most intense emotional pain and distress. Again, the main cause of limerence is the low serotonin neurotransmitter brain cells chemical and the surge of powerful brain cells chemical dopamine, noradrenaline, and phenylethylamine. And as licensed acupuncturist, there are signs that your body says that you are imbalanced with these chemicals. So let's have self-check. So we have to use my acupuncture anatomy book. In lumbar area, from lumbar 2, this is the lumbar vertebra, lumbar spine. Press this part of your back. By using your first metatarsal bones, press this area of your lower back at the medial aspect of your elbow here. 1.5 June lateral to the lower border of the spinous process. Ito yun, spinous process. Ito. The second lumbar vertebra or lumbar 2. This area, if you find tenderness or pain, that means your brain chemicals are imbalanced. So you have to undergo auricular acupuncture to balance the 4 neurotransmitter chemicals of our brain. There are also ways to balance your brain chemicals. Some are in foods, but the beauty of acupuncture is that the treatment is direct and not interrupted. Yun ang kagandahan sa acupuncture. As licensed acupuncturists, we have auricular acupuncture to balance these 4 neurotransmitter powerful chemicals of our brain, the serotonin, dopamine, endorphins, and oxytocin for mental health or healthy minds.
please like and subscribe my YouTube channel. Thank you and God bless.